Welcome to the X-Series ECG monitoring module. The X-Series offers the only diagnostic display of up to 4 different ECG waveforms. The X-Series unit can be used to monitor the electrocardiogram. 12-lead ECG monitoring is also available, which provides simultaneous acquisition and storage of 12-lead information. The device is capable of monitoring all 12 leads, and a 12-lead snapshot, resting ECG, is easily acquired. ECG monitoring can be done with therapy electrodes, such as CPR stat pads and PD pads too, as well as with other therapy electrodes. ECG electrodes can also be used to monitor the ECG. To learn more about therapeutic electrode placement and skin preparation, review the Using the Device module. The X-Series can monitor the electrocardiogram with the following configurations: 3-lead, 4-lead, 5-lead, or 12-lead. For 3-lead placement, place the RA lead outwardly on the right shoulder. Place the LA lead outwardly on the left shoulder, and place the LL lead on the patient's left midclavicular line below the umbilicus. For 4-lead placement, place the RA lead outwardly on the right shoulder. Place the LA lead outwardly on the left shoulder, and place the LL lead on the patient's left midclavicular line below the umbilicus. Place the RL lead on the patient's right midclavicular line below the umbilicus. For 5-lead placement, place the RA lead outwardly on the right shoulder. Place the LA lead outwardly on the left shoulder, and place the LL lead on the patient's left midclavicular line below the umbilicus. Place the V lead on any of the designated V lead locations on the chest. Place the RL lead on the patient's right midclavicular line below the umbilicus. For 12-lead placement, place the RA lead outwardly on the right shoulder. Place the LA lead outwardly on the left shoulder, and place the LL lead on the patient's left midclavicular line below the umbilicus. Place the RL lead on the patient's right midclavicular line below the umbilicus. Find the angle of Louis and palpate second rib on right. Let finger fall into second intercostal space. Palpate downward 2 more intercostal spaces and apply V1 electrode at right sternal border, 4th intercostal space. V2 left sternal border, 4th intercostal space. V3 directly between leads V2 and V4. V4 midclavicular line, 5th intercostal space. V5 between V4 and V6 horizontal to V4 and V6 mid-axillary line horizontal to V4. Pressing the Lead Select Quick Access key will toggle through all available ECG leads for primary monitoring lead. Use the navigation keys to highlight the lead indicator for any monitoring lead and press the Select key. A drop-down box will appear, giving the provider a list of all available options for monitoring functions. This option also provides for the ability to insert, cascade, or remove tracings to customize the display. You can fit up to 4 waveforms on the X-Series display. The first waveform at the top of the display is always an ECG waveform. In the following example, lead 2, RALL, is the source of the ECG waveform trace. To change the lead size using the navigation keys, highlight the size indicator of any parameter and hit the Select button. A drop-down box will appear showing all of the size options available. Scroll up or down using the navigation keys and use the Select button to select desired option. The 12-lead key accesses the X-Series 12-lead monitoring capabilities. The patient information icon appears as a clipboard with a chart attached. The patient's age and gender are most important fields. The 12-lead interpretive algorithm will alter interpretation based on age and gender variables. If you do not enter a patient's age and gender, the X-Series will, by default, assume you are treating a 45-year-old male patient and adopt its diagnostic finding for this patient type. This view provides the user with a complete cardiac picture of the patient. The user is also able to easily identify artifact and poor lead contact. Pressing the 12-lead snapshot key initiates the acquisition process. You now have a split screen as a result of the 12-lead acquisition. On the left is a series of 6 windows that mirror what your 12-lead printout looks like. The first page is your interpretive statement, or the results of the analysis. On the right, you'll notice that there is a dynamic ECG, so you can continue to monitor your patient. You'll notice the scroll key, the second button down, which you can use to scroll through various pages. And on page 2, there is patient demographic information as well as global measurement. As we scroll through, we can see the various pages on the ECG, which allows you to select from 4 consecutively acquired 12 leads and choose the best quality tracing. This will give you a full look without printing unnecessary paper strips. When you press the 12-lead transmission key, a menu of pre-configured, predetermined distribution locations pops up. Use the navigation keys to scroll up or down to highlight the one you want. Then, press the Select button. Finally, use the navigation keys to scroll down to the Transmit option. Then press Select button again. The X-Series offers additional advanced alarm monitoring over and above the standard parameter alarms. Recognizes life-threatening arrhythmias such as asystole, VF, VT, and extreme brady or tachycardia. Respiration is monitored with impedance pneumography technology, which means that breaths are measured through changes in thoracic impedance. A standard ECG lead cable is used, leads 1 or 2, so no additional adapters or cables are necessary. Also, the X-Series automatically transitions from pneumography to capnography when the latter is activated.